Hello students, I am Dr. KOMAL RATHORE, Assistant Professor of KOMAL VIDHYA, in Faculty of Ayurvedic Science in JAYOTI Vidyapeeth Women's University, Jaipur, Rajasthan. So, today's session we will discuss about dentition and dental care in Ayurveda. So, first of all, Dantotpatti Prakriya. According to Ayurveda, Dantotpatti Prakriya and in modern physiology of teeth eruption. Has been clearly mentioned by Vakat. Teeth originate from Asti and Majja. Since they are incomplete, spent during first to fourth month of life, these teeth fall off and new teeth erupt. Again, this is no re-eruptions of new teeth in age because of inadequate of these dhatus. So, Dantotpatti Kal, period of dentation, according to Vakat, in a child who may possess long life to tooth eruption will start by 8 months or later. Whereas in child who has lesser longevity of life, tooth eruption may start as earlier by 4th month. If tooth eruptions occur even at lesser age due to intolerable pain, the child will not achieve complete dhatu development. Like Bhagavad Kashyap also mentioned the feature of tooth eruption with various signs and symptoms in between 4th to 8th month. Attribute specific sign and symptoms according to various months. The teeth inseminated in the 4 month are weak, decay early, and will be afflicted with so many diseases. The one which erupt in 5th month are shaky and morbid sensitivity to get easily affiliated the various disease. The one that erupt by the 6th month are inverted, dirty color, and susceptible to the dental caries, whereas one that erupt in the 7th month are with two pocket, slit, stripped, broken, dry, irregular, and protuberant. If the tooth erupt in the 8th month, these are the best qualities. Kashyap has following concept regarding dentition. So total teeth are 32 in number, out of which 8 are Chakrija, appears only once in a life, remain in the same form, and remaining are Dvij, that which has rebirth. Milk deciduous teeth erupt in the same month, corresponding the month of intrauterine life in which the formation begins, the month in which the child cuts its teeth, correspond to the year in which temporary tooth fall, the permanent teeth begins to grow. Names of various teeth have been given by Kashyap. These are Rajdant, Vats, Dranshra, and Hanavya. The middle two teeth are Rajdant incision and are considered sacred. Teeth by the side of Rajdant is called Vatsak, means canine. And the other teeth by the side is called Dhanshra, premolar. The rest is called Hanavya, means molar. The name because are helpful in mastication. Teeth are erupt early in the female than the male because their teeth are distant and soft, while stronger in male. Girls feel fewer problems than boys during teeth eruption. Formation, eruption, growth, and development. Falling, strength, and weakness all depends on certain factors like race, nature, maternal and paternal factor. Means heredity. And ectoplasm. Bhagavad nation regarding eruption and fall of tooth is similar to Kashyap. He also opines that cutting off each teeth start usually before the age of 8 months. Time of eruption and shedding of primary teeth. The eruption of permanent teeth as accepted by modern anatomists and dentists is mentioned in the following. Kashyap has mentioned 4 types of dentition: Samudak, Samvrit, Vivrat, and Danta. So, Sampath Samudak. Samudak means a joint with sockets like a cup. These type of teeth develop in the condition of chaya, malnutrition of child. These teeth may fall very frequently. So next is Samvrit. They are unauspicious and remain dirty. Vivrit, these type of teeth causes excessive salivations because they are not fully covered by lips. There are many chance causing disease of teeth. And then Sampath, there are auspicious teeth having all type of characteristics of healthy teeth. And now time of eruption of teeth and its effect. Kashyap narrates that if eruption of teeth takes place before the age of 8 months, there are always chance to complication of teeth. Complication of teeth that may appear in various months as follow. Bhagvat is also a similar opinion that 8 months of appropriate for eruption of teeth in a healthy child. Children in which teeth erupt before the age of 8 months, it has pointed out another fact that due to excessive pain causing defective maturation of Dhatuj bija. Bangsen has different concept regarding the effect of early dentition. According to him, family member of child are affected if dentitions occur before the age of 8 months. The child who has tooth eruption lagging from 1 to 7 months of age is considered to be inauspicious for father and mother, siblings, and all family members including servant and teacher, etc. So periods and effect. 4 months eruption of teeth weak, fall very easily and diseased. Fifth month loose and disease. 6 month defective in shape, dirty, discolor and affected with caries. 7 month crack having lines, broken, dry and forward protruding. 8 month having all qualities of healthy tooth. Qualities of healthy teeth and gums. So Prashastadanta and Dantbandhana, defective teeth, Aprashastadanta. Kashyap has mentioned that healthy teeth should be complete, white, unctuous, smooth, clean, and disease-free, with the slight protuberance of upper ones. It should also have an evenness, redness, unobtrusiveness, and completeness of gum, with big, compact, and stableness of root. He also mentioned the features of defective dentation. The main features are less or more in number, white or black in color, with undivided gum. So, dentational disorder and its pathogenesis. Now, it's earlier we will talk about the types of dentations according to Ayurveda, and now dentitional disorders and its pathogenesis we will discuss. Even the eruption of teeth may also be causes for many diseases in children, especially such as fever, diarrhea, of vomiting, headache, uh, abhishand, potki, and viscer. And madhya dhatu on maturation reaches to, dantashaya, tooth socket to jaw and gum, are produce some irritations. The child will feel itching sensation on gums due to cuff situated in gums, so he may bite the breast during sucking. Whatever articles the child finds, he bites and presses it again gums to relieve itching and pain. Radiated vayu in the associated puff reaches to asti and majja and spread the whole body. At the same time, vayu itself, or with the help of pitta, radiated other dhatu and mals excretory material and produce various complications during dentition. So as the teeth penetrate the gum, inflammation and sensitivity sometimes occur. A condition is referred to as teething. The child may become irritable and salivations may increase markedly. Bacteria invasions through breaking in the tissue and under the gingival flap covering the teeth may be responsible. A blunt frame object for the infant to bite usually provides same relief. Incision of gums in seldom indications. There is no definite evidence to support claim to a complete temporary systemic disturbance, such as low-grade fever, facial rashes, and mild diarrhea. However, there may be one possibility that during dentition, due to irritations of gum, children used to bite any object. They find these objects may be dirty and possible can transfer various microorganisms responsible for respiratory and gastrointestinal and other disorder. So what is the treatment? So treatment in this disease is caused by the eruption of teeth. The child should not be restrained too much regarding food and other activity. Disease caused by eruption of teeth subside even by their own occurred after the teeth erupt. So diet during dentition. For better dentition, Wagbert has prescribed that the child should be provide milk or other lagu, light to digest, and branga, nourishing diet. Milk should not be discontinued suddenly from the diet of children. Milk is the best source of calcium. The requirement of calcium is increased during dentition, thus the milk can fulfill requirement of calcium. And according to Ayurveda and dental health, Ayurveda dental health, Dant Swasth in Sanskrit is held to be very individualistic, varying with each person's constitution, prakriti, and climate changes resulting from solar, lunar, and planetary influence. Kal Pari Parimal. The body constituent is classified based on the predominance of one or more of the three doshas, Vata, Pitta, and Kapha. The dominant dosh in both the individuals and the nature determined health care in Ayurveda, including dental. So that's all about dentitions and their treatment. Hope the video is informative and beneficial to you. Thank you.